like to ask practitioners what percentage of their patients have dry eye. We're often surprised to hear that some practitioners say that it's as low as 10%. We're far more in the camp of those that say that it's 95%, and in fact, have adopted a policy that we blame every patient as having dry eye until proven innocent. First, we start by looking at the eyelashes to differentiate whether the patient has blepharitis or Demodex as a cause of some of their symptoms. Next, we like to look at the palpebral conjunctiva to find out whether the patient has any follicles or papillae indicating some sort of allergy, but also we're looking for redness as a sign of potential inflammation. We also evaluate the lid wiper area very closely, as in fact many of our patients have lid wiper epitheliopathy even before they have symptoms of dryness. Next, we look at the cornea, and we're far more surprised at how much corneal staining patients have, and have discovered that unless we look with fluorescein, we may miss a patient's early dry eye symptoms. We also use interferometry on many of our patients to find out if they have a deficiency in the lipid layer of their tears. The tear lab helps us understand the patient's tear osmolarity, and we're able to differentiate inner eye differences between the patients with this test. Meibography has been a critical component to differentiate the severity and progression of the disease that patients have. We find that far more patients have meibomian gland loss than we would have ever imagined had we not used this instrument. And last but not least is the use of Inflamadry. In fact, we did a study in our office that showed that 63% of the patients that walked in the door had positive Inflamadry test. This indicates that patients, even that aren't symptomatic, may be on their way to develop some sort of dryness over time. So before jumping to other diagnoses or simply passing over, realize that the symptoms of dry eye are problematic, and if we can avoid those symptoms for patients by detecting early stage disease, we can help them out. But yet, before passing over into other diagnoses, ensure that your patient does not have dry eye, and ultimately, you can improve their quality of life.